Your legs are trapping fluid that your heart is struggling to pump back up. And if you ignore those swollen ankles tonight, you are setting yourself up for much bigger problems tomorrow. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share science-backed health tips like this every single day. Look, I have spent years looking at health data, and I have seen the same patterns over and over again. People think swelling is just a normal part of getting older, but that is a dangerous mistake to make. When your ankles stay puffy, your body is sending you a loud distress signal. My goal today is to give you the exact tools you need to stop that swelling and get your mobility back. We are going to look at simple movements that act like a pump for your circulation. Now, before we continue, tell me your age and where you are watching from in the comments. This helps us understand who we are helping. Here is what most people get wrong. They think the only way to stop leg swelling is to sit still and prop their feet up all day. That is actually the opposite of what you should do. A 2022 study from the University of California found that seniors who moved their calf muscles regularly reduced fluid buildup by 38% compared to those who stayed sedentary. When you sit still, you are essentially letting gravity win. You need to act like a traffic cop for your own blood flow. Your muscles are designed to squeeze your veins and push that fluid back toward your heart. If you do not use them, that fluid just sits there in your lower legs. It is not just about comfort, it is about keeping your heart from working overtime. Let me explain why this happens at such a deep biological level. Your circulatory system is a closed loop that relies on pressure differences to move blood. Your heart pumps blood out through your arteries, but the return journey through your veins is much more challenging. Unlike arteries, veins do not have thick muscular walls to push blood along. Instead, they rely on a combination of factors including one-way valves and the contraction of surrounding muscles. When you walk or move your legs, your calf muscles contract and squeeze the deep veins, pushing blood upward toward your heart. This is often called the skeletal muscle pump. As you age, several things happen. Your veins lose some of their elasticity. The one-way valves can become leaky, and you may become less active. This means the muscle pump is not working as efficiently, and fluid begins to pool in your lower legs due to gravity. The fluid that accumulates is not just water. It is a mixture of water, electrolytes, and proteins that have leaked out of your capillaries. Over time, this can lead to chronic venous insufficiency, a condition where your veins struggle to return blood to your heart. The swelling you see is a visible sign of this underlying circulatory challenge. If left unaddressed, chronic venous insufficiency can lead to skin changes, ulcers, and even infections. The skin on your lower legs may become dry, flaky, and discolored, and you may develop open sores that are difficult to heal. This is why it is so important to address leg swelling early, before it progresses to a more serious condition. Now let me tell you about a man named Robert. Robert was 68 years old and had been a truck driver for most of his life. He spent hours behind the wheel, and over the years he noticed that his ankles and feet were becoming increasingly swollen. He thought it was just a normal part of getting older and tried to ignore it. He would prop his feet up on the couch after a long day, but the swelling never really went away. He started having difficulty putting on his shoes, and his legs felt heavy and tired. His daughter, who was a nurse, became concerned and urged him to see a doctor. The doctor told him that he had early-stage chronic venous insufficiency and that he needed to start moving his legs more. Robert came to me looking for practical, simple solutions that he could do at home without any special equipment. I gave him a routine of simple exercises that he could do while sitting in his favorite chair. He started with ankle pumps and seated marches. Within 2 weeks, he called me excitedly to say that his shoes were fitting better and that the heavy feeling in his legs was gone. He told me, "I felt like I was carrying around bags of sand in my legs. Now I feel like I can move freely again." Robert's story is a powerful reminder that you do not need to accept swelling as a permanent part of aging. Small, consistent movements can make a world of difference. He also told me that he felt more confident walking and that his balance had improved. He was no longer afraid of falling, which is a common fear among seniors with leg swelling. His experience is a testament to the power of simple, consistent action. The first exercise that can transform your circulation is the ankle pump. Most people think this is just a useless movement, but actually it is the most effective way to engage your calf muscles while sitting down. Think of your calf muscle as a second heart. Every time you flex your foot, that muscle squeezes your veins and pushes blood upward. A 2023 study from Oxford University showed that performing ankle pumps for just 10 minutes, 3 times a day, can significantly lower leg volume. Here is how you do it. Sit in a sturdy chair with your back straight, Extend one leg out in front of you. Point your toes away from you as far as you can, then pull them back toward your shin. Do this 20 times for each foot. You should feel a slight stretch in your calf. If you feel pain, stop, but keep moving slowly. It is that simple, and you can do it while watching your favorite show. The key is to perform the movement slowly and deliberately, taking about 2 seconds to point and 2 seconds to flex. This ensures that the muscle is fully engaged and that the venous pump is activated. You can also do this exercise with both feet at the same time if you prefer. The more frequently you do this, the better your circulation will become. If you have difficulty moving your foot, you can also use a resistance band around your foot to add a gentle challenge. Start with 10 repetitions and gradually increase to 20 as you get stronger. But wait until you see the next exercise, because it works the larger muscles in your legs. Quick question: have you experienced swelling in your ankles or legs recently? Comment yes or no below. The second exercise is the seated march. Most people think you need to go for a long walk to get your blood moving, but actually you can get the same benefit right in your living room. When you lift your knees, you are activating the large muscles in your thighs and hips. This creates a pumping effect that helps clear out stagnant fluid. A 2021 study from the Mayo Clinic found that rhythmic movement of the legs increases lymphatic drainage, which is the system that carries fluid away from your tissues, by nearly 25%. To do this, sit tall in your chair, lift one knee up toward your chest as high as is comfortable, then lower it slowly. Alternate legs for 30 repetitions. Make sure you are not slouching because you want to keep your core engaged. It feels like a light workout, but it is actually a circulation booster. The lymphatic system works alongside your circulatory system to remove excess fluid from your tissues. Unlike the circulatory system, the lymphatic system does not have a central pump like the heart. Instead, it relies on the movement of your muscles to propel lymph fluid through its vessels. By marching in place, you are helping your lymphatic system do its job more efficiently. If you find yourself getting out of breath, slow down the pace or reduce the number of repetitions. The goal is to keep moving, not to exhaust yourself. You can also do this exercise while standing if you prefer, but hold on to a stable surface for balance. You can also add a small twist to this exercise by lifting your knee out to the side instead of straight up. This engages different muscle groups and helps improve your hip mobility, which is often reduced in seniors. Do 10 repetitions of the side march on each leg. If you have difficulty balancing, you can hold on to the sides of your chair or place one hand on a nearby table. The goal is to keep moving, not to go fast or high. Quality of movement is more important than quantity. As you get stronger, you can increase the number of repetitions or the height of your knee lifts. This exercise also helps improve your core stability, which is essential for preventing falls. If you have knee pain, you can reduce the height of the knee lift or perform the exercise more slowly. You can also try marching with a small pillow between your knees to engage your inner thigh muscles. This adds a bit of variety and helps strengthen different muscle groups. The seated march is also a great way to get your heart rate up slightly without putting stress on your joints. It is a low-impact exercise that can be done by almost anyone, regardless of fitness level. The third exercise is the heel raise. Many people think this is only for balance, but it is actually the best way to strengthen the muscles that support your ankles. When these muscles are strong, they act like a support system that keeps fluid from pooling around the joint. A 2024 study from the University of Tokyo found that seniors who practiced heel raises daily improved their venous return, which is how blood gets back to the heart, by 15%. Stand behind a sturdy chair and hold onto the back for safety. Rise up onto your tiptoes as high as you can, then slowly lower your heels back to the floor. Do not rush this. Take 3 seconds to go up and 3 seconds to go down. Aim for 15 repetitions. If you can only do 5, that is perfectly fine. You will build up your strength over time. As you get stronger, you can try doing the heel raises without holding onto the chair, but only if you feel stable. You can also do them on one leg at a time for an extra challenge, but again, only if you have good balance. If you feel unsteady, always keep a hand on the chair. The heel raise is also a great exercise for improving your overall ankle stability, which can help prevent ankle sprains and falls. Strong ankles are essential for walking on uneven surfaces and for maintaining your independence as you age. You can also do this exercise with your toes pointed slightly inward or outward to target different parts of your calf muscles. This variation can help you build a more balanced strength in your lower legs. The heel raise is particularly effective because it directly targets the soleus muscle, which is a deep muscle in your calf that is often called the second heart. The soleus muscle is unique because it is composed primarily of slow-twitch muscle fibers, which are fatigue-resistant. When you perform heel raises, you are activating this muscle and creating a powerful pumping action in your veins. This is especially important when you are standing or walking, as the soleus muscle works continuously to push blood upward. By strengthening this muscle, you are improving your body's natural ability to circulate blood and prevent pooling. If you have difficulty balancing, you can also perform this exercise while sitting down by lifting your heels off the floor and holding for a few seconds. This is a good starting point if you are not comfortable standing. Over time, you can progress to standing heel raises with minimal support. You can also add a small weight, like a can of soup, to each hand for added resistance. This will help build strength more quickly. Just be careful not to lean forward or backward as you lift. Keep your spine straight and your core engaged. The heel raise is one of the most underutilized exercises for seniors, and it can make a dramatic difference in your circulation and your balance. Start today, and you will notice the benefits within a week. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. The fourth exercise is the wall calf stretch. People often think stretching is just for athletes, but actually it is critical for anyone who spends a lot of time sitting. Tight muscles can actually block your veins and slow down blood flow. A 2020 study from the University of Alberta showed that keeping your calf muscles flexible can reduce the sensation of heaviness in the legs by 30%. Stand facing a wall about 2 feet away. Place your hands on the wall for balance. Step 1 foot back and keep that heel pressed into the floor. Lean forward until you feel a gentle stretch in the calf of your back leg. Hold this for 30 seconds and breathe deeply. Switch sides and repeat. You are not trying to be a gymnast here, just trying to open up those pathways for blood to flow freely. If you feel a sharp pain, ease up immediately. Stretching should never be painful. You can also do this stretch with your back knee slightly bent to target the deeper soleus muscle. For a more intense stretch, straighten your back leg completely. Make sure your back foot is pointing straight ahead, not turned out. This ensures that the stretch is directed at the correct muscles. You can also do this stretch against a step or a curb by dropping your heel below the level of your toes. This gives a deeper stretch, but be careful not to overdo it. Hold on to something stable if you try this variation. Stretching your calves regularly can also help relieve foot pain and plantar fasciitis, which are common problems for seniors. Incorporate this stretch into your daily routine, and you will notice that your legs feel lighter and more mobile. Let me explain why stretching is so important for circulation. When your calf muscles are tight, they can compress the veins that run through them. This compression can restrict blood flow and make it harder for blood to return to your heart. Over time, this can lead to increased pressure in your veins and more fluid leakage into your tissues. Stretching your calf muscles helps relieve this compression and allows your veins to function more efficiently. It also helps maintain your ankle mobility, which is essential for walking and balance. If you find that you cannot keep your heel flat on the floor when you stretch, you can bend your back knee slightly to reduce the intensity. The goal is to feel a gentle pull, not a sharp pain. You can also do this stretch against a sturdy table or counter if you do not have a wall nearby. Incorporating this stretch into your daily routine can help prevent falls by improving your balance and stability. You can also do this stretch after a warm shower when your muscles are more relaxed. Tight calves are often a hidden contributor to lower back pain as well, because they alter your gait and put stress on your spine. By keeping your calves flexible, you are not only improving your circulation, but also protecting your back. It is a small investment of time that pays off in multiple ways. The fifth and final exercise is leg elevation with rotation. Most people just prop their feet up and go to sleep, but actually adding small movements while your feet are up is much better. When your legs are above your heart, gravity helps the fluid drain, but adding gentle rotations helps move that fluid through your lymphatic system. A 2023 study from Johns Hopkins University found that combining elevation with active range of motion movements reduced chronic swelling significantly faster than rest alone. Lie on your back on a comfortable surface. Put a few pillows under your calves so your feet are higher than your heart. While in this position, slowly rotate your ankles in circles for 1 minute. Then do the same in the other direction. This feels great and it does the hard work for you. You can also add toe wiggles and foot flexes while your legs are elevated. The combination of gravity and muscle contraction is incredibly effective for moving stagnant fluid. If you do not have a place to lie flat, you can do this in a recliner or on a sofa with your legs resting on the armrest. The key is that your feet are above the level of your heart. This position also helps reduce pressure in your veins and gives your circulatory system a break. Try to spend 10 to 15 minutes in this position every evening. It is a wonderful way to unwind and let your body recover from the day. Let me elaborate on the benefits of this combination. Elevation alone allows gravity to assist in draining fluid from your legs, but it is a passive process. By adding ankle rotations, you are actively contracting and relaxing the muscles around your ankle joint. This muscle activity stimulates the lymphatic system, which is responsible for removing excess fluid and waste products from your tissues. The lymphatic system does not have its own pump, so it relies on muscle contractions to move lymph fluid through its vessels. By combining elevation with movement, you are creating the ideal conditions for fluid clearance. You can also add gentle knee bends while your legs are elevated by sliding your heels toward your buttocks and then straightening them. This engages your hamstrings and quadriceps, which further enhances the pumping effect. Aim to spend about 10 to 15 minutes in this elevated position each day, ideally in the evening when your legs are likely to be most swollen. If you find it uncomfortable to lie flat, you can also do this while sitting in a recliner with your legs raised on an ottoman. The important thing is to keep your feet higher than your heart. This position also helps reduce fatigue in your legs and can improve your sleep quality. Many people find that doing this before bed helps them fall asleep more easily because their legs feel relaxed and light. It is a simple, soothing ritual that has profound benefits for your circulation. I would love to hear your story. What made you click on this video today? Share in the comments. Now let us pump the brakes for a second. I am not saying this to scare you, but you need to know when these exercises are not enough. If your swelling is only in one leg, if it is painful, or if your skin turns red and feels hot, you need to see a doctor immediately. This could be a sign of a blood clot, which is a serious medical emergency. Also, if you are taking medications for blood pressure or heart conditions, always talk to your doctor before starting a new exercise routine. Sometimes your swelling is a side effect of your medicine and you need a professional to adjust your plan. Listen to your body. If you feel chest pain, shortness of breath, or dizziness, stop everything and get medical help right away. These exercises are meant to help, but they are not a replacement for professional medical advice. Your health is your most valuable asset, and you should never take unnecessary risks. Always err on the side of caution. If something does not feel right, get it checked out. It is better to be safe than sorry. Let me expand on these warning signs. A blood clot, also known as deep vein thrombosis, is a condition where a clot forms in a deep vein, usually in your leg. This can cause swelling, pain, warmth, and redness in the affected area. The danger of a blood clot is that it can break loose and travel to your lungs, causing a pulmonary embolism, which can be fatal. This is why it is so important to seek medical attention if you experience these symptoms. Additionally, if you have heart failure or kidney disease, the swelling in your legs may be related to fluid overload, and you may need medication adjustments. Always keep your healthcare provider informed about any changes in your symptoms. They can help you determine the safest and most effective approach to managing your swelling. If you are diabetic, pay close attention to any changes in the skin on your feet, as swelling can increase the risk of skin breakdown and infection. Check your feet daily for any cuts, blisters, or changes in color. A small sore on a swollen foot can quickly become a serious infection if not treated promptly. Use a mirror if you have trouble seeing the bottoms of your feet. If you notice any changes, contact your doctor right away. Never ignore a foot injury, no matter how small it seems. Your feet are the foundation of your mobility, and you need to protect them. So you are convinced, but you are thinking, how do I actually do this? You do not need any fancy equipment. You do not need a gym membership. You just need a chair, a wall, and a little bit of consistency. Start with just 5 minutes in the morning, pick 2 of the exercises we talked about, and just get started. You can do the ankle pumps while you drink your morning coffee. You can do the heel raises while you wait for the microwave to finish. It is about fitting these small movements into the life you already lead. If you have a budget of $0, you are already set. The most important tool you have is your own commitment to move every single day. Your body will tell you if it is working because you will notice your shoes fitting better and your legs feeling lighter by the end of the week. Do not wait for a perfect time. Start right now, right where you are. Even if you are sitting in a chair as you watch this, you can start doing ankle pumps immediately. That is the beauty of these exercises. They are accessible to everyone, anywhere. You do not need to change your clothes or drive to a gym. You just need to start moving. Let me give you a sample daily routine that you can follow. In the morning after you wake up, sit on the edge of your bed and do 20 ankle pumps on each foot. This gets your circulation started after a long night of rest. At lunchtime, do a set of seated marches while you wait for your food to heat up. In the afternoon, stand behind a chair and do 15 heel raises. In the evening, lie down with your legs elevated on pillows and do ankle rotations for a few minutes. You can also incorporate the wall calf stretch after a warm shower, as your muscles will be more pliable. This routine takes less than 10 minutes total but provides significant benefits throughout your day. If you are watching television, you can do ankle pumps during every commercial break. This adds up to a lot of movement without even thinking about it. If you have a favorite show that is an hour long, you can easily get in 100 ankle pumps during that time. You can also challenge yourself by increasing the number of repetitions each week. Write down your routine and check off each exercise as you complete it. This helps build consistency and makes you feel accomplished. Remember, the goal is not perfection, it is progress. Even if you miss a day, just start again the next day. What matters is that you keep coming back and keep moving. Look, there is a lot of noise out there about what you should and should not do. You do not need to overthink this. You do not need complicated routines or expensive supplements. You just need to keep the blood moving. Start with just 5 minutes of movement a day. That is all it takes to see a change. Your body is incredibly resilient and it wants to heal, but it needs your help to do it. If this helped you, hit that like button. And if you want more videos like this, make sure you are subscribed because we post new health tips every single day. Stay healthy, stay strong.